What causes caregiver stress when managing post-op nausea? Imagine trying to keep someone comfortable while feeling overwhelmed yourself. That's what managing post-operative nausea can do to caregivers. It's not just about giving medication. It's about handling a complex, unpredictable situation. Post-op nausea often happens because anesthesia affects the brain's balance centers, making patients feel sick. Pain medications, especially opioids, can slow down digestion and cause nausea or vomiting. Sometimes, the surgery itself, especially on the abdomen or stomach, triggers nausea due to blood loss or dehydration. Because these causes vary so much, caregivers need to watch for many symptoms like vomiting, dehydration, or electrolyte imbalances. This can be stressful because it's hard to tell what's normal and what needs urgent care. Nausea after surgery can last 4 days, and its intensity can change quickly. Caregivers might feel anxious because they don't know when symptoms will improve or worsen. If the patient has a history of motion sickness or previous nausea after surgery, it becomes even harder to predict what will happen next. Managing medications adds another layer of difficulty. Pain relief often involves opioids, which can make nausea worse. Caregivers have to carefully time and dose these medicines to balance pain control with nausea prevention. If nausea causes vomiting, it can interfere with taking oral medications or eating, making recovery slower. This can lead to frustration and worry about the patient's progress. Providing emotional support is also demanding. Caregivers need to help with position changes to reduce nausea, assist with medications, and monitor for signs of dehydration or worsening symptoms. This constant attention can be physically tiring and emotionally draining, especially if the patient becomes distressed or frustrated. Caregivers must also know when nausea is just part of normal healing versus a sign of complications like infection or bowel blockage. This requires vigilance and quick decisions, which can be stressful. Managing diet and hydration is another challenge. Caregivers often need to encourage small, bland meals and plenty of fluids while avoiding foods or smells that trigger nausea. Coordinating all these tasks along with other recovery needs adds to the workload. In the end, caregiver stress from managing post-op nausea comes from its many causes, unpredictable course, medication side effects, and the constant effort needed to keep the patient comfortable and safe. Knowing these factors can help caregivers prepare better and seek support when needed, making the process a little easier for everyone involved.